community health workers deployed in Gauteng Sedibeng district to combat the COVID-19 virus say they are facing an uphill battle. In this community, they are viewed with suspicion, fear and mistrust, which makes it impossible to do their work.
Ever since there's been this COVID, we've had challenges because people are no longer allowing us to go in their homes because they say we are coming here to infect them with the coronavirus.
Fears about the new respiratory disease could have far-reaching consequences.
Communities are not opening up. It appears that the virus has been highly stigmatized.
Government says because of the stigma, it's unknown how far the disease has spread in vulnerable communities, which could be deadly as more people get sick.
In terms of the fight against the pandemic, it's so important that we deal with the issue of stigma.
Uncertainty about the coronavirus has been fueled by rumors and misinformation.
Our community has always been uncertain about the condition because of wrong messages that are being set up.
Government hopes that as it relaxes restrictions on the lockdown, it will increase mass-scale testing, the key to flatten the curve and minimize the death toll. As we shadow some of the people on the front line in Sedibeng, we find out that the stigma is just one of the challenges that could derail the government's efforts to fight the pandemic. "39-year-old Sylvia Sapu has been working in the Sedibeng district as a community health worker for a number of years. With the outbreak of the coronavirus, she's been deployed to screen people at their homes for the virus. She says, as a frontline worker, she fears for her safety.
I am very anxious to such an extent that I had to take my kids and take them to my mother because I don't feel that for them staying with me, it's safe. So it's best if I'm alone at home, and then when I come from work, I have to take my clothes off and then wash myself because I can't do anything. So with kids around, when I come from work, they're gonna want to hug me, and I feel in fear for them that if I am infected, it means I'm also going to infect them.
Community health workers are the first line of contact in vulnerable communities. We joined them on a door-to-door campaign when the president announced an extension of the lockdown.
So it's a screen papa for COVID-19. I can't even go ahead and feel like I feel corona. Oh, hanta ho ka bua le rona papa ha re poste. Ha o hanta ho ka bua le rona. Ke kgetho ya hao hore o ka kgetha ho bua le rona kapo ha o batla ho bua le rona. Anyway, ga leboha papa. Okay, thank you.
The young man appears suspicious of the health workers that arrived unannounced on his doorstep. We walk further into the community. At the Mkize family, a couple in their twilight years, they are expecting the health workers. The visit forms part of a routine medical checkup. It's also an opportune moment to screen for the respiratory disease. But apart from a few visits like this one, Sylvia says she and her colleagues are being denied access to other households.
People are no longer allowing us to go in their homes because they say we are coming here to infect them with the coronavirus. Especially when they see us as a community health worker wearing uniforms, like wearing masks, they just think we are coming with, they have this misinterception that we are coming with the virus to spread the virus and leave them being sick. Even when we screen, They don't understand that we are screening for their own safety.
Being denied access means that the government will not be able to control the contagion in this community. This could have devastating consequences as more people get infected.
Part of the screening and testing process is to establish the prevalence of the disease, and until we have the majority of the people being screened and tested, we can then give you a sense of how much percentage of the prevalence of the disease.
The health department says it's been cautious of what information it discloses so it doesn't create further panic. But recently, it's published a breakdown of infection per district and suburb.
In general, what we say about stigma is that we have to give people facts, we have to give them accurate information, we have to be transparent. And there's that one point that people continuously raise now, that when we report the incidences of people who are infected, we must now be specific in terms of a suburb. And I know after the suburb, it will be saying, no, it's not enough, we need a street. And after the street, they'll be saying, no, but you must now tell us which houses, And that's what information that we say as the department, that this is the information that as public health experts, public health officials, we are going to use. But for the public and to protect those who are COVID positive, we must not able to divulge that.
At the Levi Mbata Clinic in Everton, a walk-in COVID-19 facility has been set up to screen and test for the coronavirus. But 3 months since the virus was detected in South Africa, officials say they are facing capacity problems.
The major challenges that we have, because this happened abruptly, we are using our current human resources that we have.
In April, some health workers' overtime payment was not paid due to technical problems. The unexpected onset of COVID-19 meant that resources had to be scrambled elsewhere. Part of the concerns is the related stigma.
The issue of stigma is something that is there, especially in periods of uncertainty. Our community has always been uncertain about the condition because of wrong messages that are being set up. If you are positive, it does not mean that it's a life sentence. It means that you are going to be treated, you are going to be self-quarantined. After 14 days, we're going to test you, and you will come out negative, which means you are no threat to anybody. That's what the community needs to understand.
Authorities have warned that without mass screening, testing, and contact tracing, the extent of contagion in communities is a ticking time bomb, which could explode with the lockdown restrictions now having been relaxed. Corinne Singh and Shannon Finn were dispatched to the Sedibeng district to help fight the coronavirus. Corinne has been working as a health worker for a while now, but for freshly graduated 22-year-old Shannon, it's a first big assignment.
This is definitely going to go down in history. It almost feels surreal. It's going to impact us for many, many, many years to come. It doesn't discriminate. It doesn't only affect your people with low socioeconomic status, but it also affects your more affluent people. It doesn't discriminate with regards to races. It affects every single person. It can affect every single person. We are literally all in this together.
The two young women say they are concerned about the shortages of PPEs, the protective gear which they have to wear for 12 hours to shield them from the virus. But this is a global problem.
Working conditions are quite hectic, actually. Being in the suit is actually not very comfortable. It's actually very hot in here. You also have difficulty breathing behind this mask. It's very airtight. But I guess we also need to protect ourselves because we do need to be out here for quite some time. We don't know how long we're going to be out here for. Hi, Papa. Please have a seat for us.
Sharon says the few people she's tested have many questions. Some of them have doubts that the virus exists.
Open.
Patients do come in with a lot of concern. They just uncertain about, their future as well, if they have the virus or not. But at the same time, lots of patients are actually unaware about the virus. A lot of them are uneducated. A lot of them even question, what is this thing? What is this thing that we're dealing with? Is it real?
It's a little uncomfortable, but you'll be fine, right?
64-year-old Joman Dlangalala is one of the few people testing today. He says he doesn't know anything about the virus, but feels he needs to test to set his mind at ease.
Ya ntshosa mara ke se ke itse ha e tlile e fihlile ke tshwanetse ho e amohela hobane ha ke tsebe hore na e tla ka mokgwa o feng e tswa kae ho tla jwang ene ke lefula la mofuta o feng jwale wa utlwa hore bothata ba yona bo bong hore e flyer moyeng hore na e etsa jwang hobane ho thwe nako tsohle re hlape matsoho. And then ha re ka hlapa matsoho ha o tshwere sefahleho o tshwanetse o hlapa matsoho jwale ha re tsebe hona ke siki e hlahang kae hore na ke di-chemical hobane e fofa moyeng ha re tsebe.
Carissa believes that the testing could pick up as people get sick. This is something that government wants to avoid at all cost, so that the coronavirus doesn't overwhelm the public health sector.
I'm in the front line. I'm exposed to the virus every day. Well, not the virus, but in difficult conditions that we may be exposed, we may contract the virus, which makes it also difficult. Am I going to be taking this home? Is my family also going to be exposed at the end of the day? So that is why we're encouraging people to actually just adhere to the lockdown rules and regulations.
With the screening area standing empty, Muriel Malabatsi, the coronavirus team leader in Sedibeng, shows us around.
The client comes in at the facility, then they wait at the waiting area. From the waiting area there are health promoters that teaches all our clients about COVID-19. From there they wait for screening. At the screening site, they are being asked whether the client has been traveled, any signs of COVID-19 or any contact. If there is any sign of those, then the patient will go for swabbing.
Meanwhile, the government says it's ready. It's had time to prepare since March this year, but it's not clear how the virus will evolve in the coming months.
It's not something that has been stagnant all along. We've already completely decanted a 240-bedded hospital in Tshwane to be a dedicated COVID-19 hospital. We are looking at the same actual situation at Bara, where there are some wards that we are going to decant, which are going to give us almost 300 beds, which also is the capacity that we are building. But we are also planning to put up external or extra capacity, and we don't want to use temporary structures, because we are also thinking beyond the pandemic. We want to put up structures that we can be able to utilize post the pandemic.
For now, social distancing, wearing masks, including good hygiene practices, are the only way to protect against the infection. But for the residents at the Sebokeng hostel in Sedibeng, these prescribed regulations are near impossible. 84-year-old Shoshana Wawana is the self-appointed plumber on the front line at the Sebokeng hostel. He stepped in when the municipality failed to deal with the ongoing sewage affecting this community for several years. We met last year when we investigated these problems. Now, with the COVID-19 virus, the health risk has escalated.
How are you people?
Zamila's attempts to get fresh air into his room is met with the foul smell of human excrement. Outside his window is a sea of raw sewage as far as the eye can see. He says it got worse since he moved here a decade ago.
Sihlala eBugqwayibeni endaweni enukayo istorage yakhona nje ayinakwanga kuphuma amanzi kuyanuka kangiba anisavuli namafestili la ngasemva kwami kugcwele idamu nje. Ingulube zihamba la ngasemuva sizenzela ebusuku nasemini. Sinexhala kakhulu njengoba kufikile COVID-19. Thina sisisulu sokuthi ingasibamba very easy ngoba asina protection. Siyezwa nje ema-radioini, siyabona ema-TVini, ezinye indawo bayasisiza lapho. Thina sikaboni la from 26 iqala la i-COVID-19 bekhuluma ngayo ukuze kube namanje asikaboni nesi, asikaboni doctor, asikaboni nje abezempilo.
Pie, homemade pie.
Outside, Sasizo Dlamini goes door to door selling food. He says he knows he will be in big trouble if he's caught selling during lockdown, but he says he has to take a risk because he needs to make a living.
Qhubeka eDurban ngiqhubeke ngithengisa iphaya ukuthi abantu bayawudla uphaya lokho kungqoqozela kakhulu kunginikeza nomdlandla ke manje inkinga sibhekene nesimo esinzima kakhulu kune coronavirus abantu bakwithi madoda ezweni lethu siyahlupheka sasokola Nkosi sixakekile bavalelekile njengamanje isiphethe nje ama sanitizers sanitizers sifakile ama mask wethu uba siziprotect phela nathi ukuze ukuba singakwazi ukuthwala legciwane elingaka.
With more people at home, the piles of waste are mounting. Animals feed on the waste that is generated by the community. In some sections, there are no roads, which poses a problem should someone require urgent medical attention.
La community yethu ngoba manje akunamuntu okeweza ukuthi ezo-explainela ngale coronavirus. Asina ma-mask, asina zinto zokuziprotecta ukuthi kwenzakalani.
Government says it's dealing with the poor sanitation issues, which are an ideal breeding ground for the virus. Scientists have found that the coronavirus survives in sewage for several days, which could be lethal if there's an outbreak in this community.
Wastewater treatment works aren't always capable of providing sufficient chlorine. So that's one of the major problems. But over the short term, think about raw sewage flowing along the Ritzbreid. And there are some feces in the water, and the COVID can, in feces, potentially survive between 2 minutes and 9 days, depending on what the circumstances are.
Back in Everton, 78-year-old Gogo Tami Mkize wonders if there will ever be a cure for the virus that has already killed so many people and infected others.
Ngithi phela abantu mabezwe kuthiwa hey ukhona oseyidlulile emhlabeni ohambile wonke umuntu uyethuka acabanga ukuthi hawu kanti lento le njani engathi ayilapheki awu ngani sithuswa ilento umuntu mase sekhavariwe lapha sevaliwe hawu ama visitor ke azombona kanjani.
The elderly are a high-risk group. Most of those infected with COVID-19 don't survive. Authorities say older people must remain in isolation at all times. For 82-year-old Mkulu Mkize, being away from the family is too much to bear.
Iyasithusa sifo nje ngokuthiwa si-strong kakhulu kubantu abadala lesifo lesi. Kube isifo esijwayelekile sikhule sazi esingeke sethuke kangaka. Ngoba kunjalo impela kunamaphilisi akunalutho. Ukuthi nje kufanele siyiphathe ngalo ndlela kufanele siyiphathe ngayo kuphela. Yonke into izohamba kahle.
We decided to go back to the young man in the beginning of our story to find out what was troubling him.
Ne ke tsohile he bo sister se batla ba tlokokota mo jarateng cause ne ke sa itse gore ba ka fitla ne ke sa nagana gore ba ka fitla a wa ne nga se dumele cause ba tsama ba testa batho a ke itse gore ba tlo ntshela yona or ba tlo testa yona fela na.
Tsepiso's mother believes that the stigma that is now associated with the coronavirus is similar to the HIV virus, where people that contracted AIDS were seen as outcasts.
Yeah, I can have a listing on coronavirus. You know, I get a sick alien at Calabarke 18, not about what thing was about to mela, Rabanonia, Ratab, but whenever no Arsavat Rabba support, Redula Lebona, Rejalebona. But whenever no coronavirus, Haratameo, Harana Kamatoho, Aratrela, Hakana, you must wash your hands, so we are cooking, Tacostrate, Utapamato, Utaralimati, Utapamato, you see, when on 36 in this usual. This one is worse.
Government says very little is known about the new coronavirus, and until a vaccine is found, we are all at risk of contracting the disease.
In for a long haul, it's a marathon, it's not a sprint. Other people have been planning for 2 months, 3 months. I think it's going to go on for a longer period, even how we have seen all the outbreaks before, the phases that they go into. The last phase is that post the peak of the infections, we are going to have lower infections as they go, and then after that, we are going to get a post-outbreak period, which now people will get seasonal or occasional infections there and there. And I'm hoping that because we're almost 12 months away from any vaccine, it means that we just have to make sure that the demand meets the capacity that we have.
With restrictions on the lockdown eased in phases and some people go back to work, police and soldiers will remain in force to ensure that citizens comply with the regulations. Government is facing its biggest balancing act, influencing people's attitudes and behavior to be more responsive in ensuring that they don't contract the virus and die from the disease.